That's why they need to take extra protein powders during their diet because
Most of them, they actually feel tired.
exercise routine is important. Constipation is very normal after the surgery. Yes. Okay.
I'm gonna drink water now.
Yeah, okay.
Every minute.
Yes.
And we don't want that. Yeah, and so guys, welcome again. This is our part 2. As you already know, it's all about health, and I'm here with the dietitian, Nayat.
Hello.
And so of course you do know this is part 2 because we have done part 1, and please guys go and watch the part 1 of our video, and then of course we welcome you back here if you finish with the part 1. So yeah, so we're gonna continue with the questions that we received, and we know some of our patients, they actually usually ask those questions. And so let's start with that one. It's about after the bariatric surgery, the patient went back to his country or her country, and the patient is just going with his or her life. But this is about if a patient doesn't follow the nutritional rules, can the stomach expand again?
Of course it's possible because their stomach got bigger before the surgery, and then they come here and had the surgery. So that's why it can get bigger again. Not as much as big, the same like before the surgery, but it can expand and it can cause with the weight gain. Okay, so they should avoid fizzy drinks, they should follow solid and liquid separation, and they should know that they should stop eating when they feel full. If they force themselves to eat more, the stomach will get bigger.
Okay, thank you. Now we're gonna go to the other questions, right? So now it's about a patient, because we do know that some patients have to follow a specific way of eating and all that, but some patients, they're not able to follow that same way of eating. So can a patient who is vegetarian or vegan have like another way of eating, like alternative nutritional programs?
Yes, we do. We do have plans for them, but they need to be aware that they need protein to heal better, to avoid muscle loss, which can cause saggy skin. That's why they need to take extra protein powders during their diet because they will need it. So we are trying to find the vegan protein powder options for them, and then we are adapting the protein powders to their diet.
Okay, so Nayat, the other question is about patients after bariatric surgery. Some of them, or most of them, they actually feel tired. So is it normal? Can you tell us the reason of that?
Yeah, it's normal because they were taking lots of calories before the surgery. And right after the surgery, they're starting very less amount of calories, like around 300, 400 calories a day. Their water intake is going to also restricted due to the surgery. So these will cause tiredness, of course.
Okay. So for the other questions is about way after having the weight loss surgery. So some patients, they usually wonder after they reached actually their ideal weight, they usually wonder how can they keep up or like just maintain that ideal weight for years after their surgery.
They need to continue their healthy eating habits if they want to keep their weight on their ideal. Eating habits are important, and plus exercise routine is important. Okay, these two, if they are together, you're not gonna gain weight one more time.
So Nayat, we do have patients that come back, right? They do have questions regarding their constipation issues, because after surgery, let's say for like the first 2, 3, or like even first months, they do experience those constipations. So what can you say about the solutions or something that can actually prevent having that issue?
So first of all, they need to drink at least 1.5 liters of water if they don't want to have constipation problem.
Per day?
Yes.
Oh, wow.
So water is important. Then they should take maybe fresh vegetables and fruits, especially the fruits which help the bowel movements, like apricot, maybe pear. They're helpful for the bowel movements. And they can take probiotic drinks or probiotic supplements from the pharmacies for the bowel movements.
Oh, okay.
But this is very normal. Constipation is very normal after the surgery. We expect these problems.
Okay. So Nayat, after bariatric surgery, you always have discussion with your patient regarding their eating, lifestyle, and all that. So when talking about their healthy habits and basically their way of eating and their lifestyle and routine, you always emphasize on the importance of consuming water, but like continuously. So why is it that vital for our patients?
Because water is helping to burn fat. Yes. So for the healthy life and for fat burn, you should focus on water, and also for a beautiful skin. If you don't want to have saggy skin problems.
No, I don't.
You need to focus on water.
I'm gonna drink water now.
Yeah, okay.
Every minute. And so now, Nayat, we came to our last question actually. And so it's about the separation, because that's a very, very important rule that you guys always say. So what can happen if the patient doesn't follow or respect the separation rule between liquid and solid?
So when they try to mix them on the first, they're gonna vomit probably, because they don't have space in their stomach for both solid and liquid. Okay, when they eat and if they force themselves to drink, the stomach will react and they will start vomiting. But after a while, stomach will get used to this and it will think, okay, I need more space, so let's stretch and make more space for both of them. So it will start getting bigger, so you will start eating more portions, more food, so it will result with weight gain.
Again.
Yes.
And we don't want that.
Of course.
We definitely don't want that. And so, okay, got you. And thank you for all these important and very, very helpful information, I believe, and I'm pretty sure for some of our patients and all of our patients out there. And thank you for coming, and thank you for having that discussion with us, and of course teaching us about how we should healthily eat. Thank you so much. Hopefully we're gonna see you next time.
I hope so.
And thank you guys. Do you want to add something?
No?
Okay.
Take care of yourself.
Yes. Thank you guys. Stay healthy, and until we see you next time. Bye.
Bye bye.